This podcast might contain mature themes and may not be suitable for all audiences. Listener and viewer discretion is advised.
Welcome to another episode of UCLA Health's podcast, Medically Speaking, with Eve Glazier. That's me. And today we're discussing integrative medicine, an evidence-based approach to healthcare that blends conventional medical therapies with complementary therapies, one that focuses on the whole person to optimize health, healing, and wellness. We're going to explore the connection between your mental, physical, and emotional health and show how an integrative perspective can benefit you as a patient and as a person. So let's start medically speaking. So today's guest is a remarkable expert in the field of integrative medicine, Dr. Elizabeth Coe. Elizabeth, you got to let me briefly sing your praises, okay? You are an assistant clinical professor of medicine here at UCLA, the David Geffen School of Medicine. You're medical director of the UCLA Health Integrative Medicine Collaborative, which we'll get into in a second. You've also pursued a lot of additional training as if you've needed, but in integrative medicine at the University of Arizona, you've gotten your yoga teacher training, and you did a physician's course in medical acupuncture. My favorite factoid is that you're a passionate home cook and you've worked in amazing restaurants like AOC and Spago's. You also happen to co-write the nationally syndicated column Ask the Doctors, alongside me.
Together.
And yes, together. And above all, honestly, you are such a wonderful physician and you're a human being. And I'm just so grateful that you're here today with me. So let's get started. I think we should just start with some really basic definitions. And so let's just start with defining what is integrative medicine.
Yeah. Oh, thank you, Eve. I am overjoyed to be here with you today. So the word integrative is derived from the Latin root integer, which means whole. Come back to high school algebra, right? So whole health, not just the body, but the mind, the spirit, the soul, even the environment and our community. So the Academic Consortium for Integrative Medicine and Health outlines this definition, which I'll share, and it's a long one. So integrative medicine and health reaffirms the importance of the relationship between practitioner and patient, focuses on the whole person, is informed by evidence, and makes use of all appropriate therapeutic and lifestyle approaches, healthcare professionals, and disciplines to achieve optimal health and healing. And I'll linger over that last part, to achieve optimal health. So health in our conventional space, we tend to think of health as the absence of disease, right? I'm healthy if I don't have any diagnoses. But health, as the World Health Organization defines, is not just the absence of a disease, but a state of complete physical, emotional, spiritual, environmental well-being. So while integrative medicine is a formal fellowship and board certification, what's important to know is that integrative medicine is a lens through which we see health. So it's a conceptual framework that can be practiced by anyone, by an internist, by a cardiologist, by a psychiatrist, by an acupuncturist, by a psychologist, and of course, by you, the listener. So as you are hearing me editorialize this, you might be wondering, this sounds great, right? Isn't this how everyone should be practicing?
Exactly.
And the answer is an enthusiastic yes. And I long for the day when we drop the word integrative and just call this good, clean medicine.
Right. But I think though that it is still new for people. I think that a lot of people aren't used to integrative medicine yet. And so it might be, I think, helpful just, at least at this point to say, how would we differentiate between integrative medicine? Is it the same as complementary? Is it the same thing as Eastern? How does it differ than traditional? And I guess when I say that, it occurs to me that is traditional, do we mean Western?
Yeah. So a central tenet of integrative medicine is the idea of blending, right? So it's not either or, it's not a choice among two, but it's an and. So there's a spirit of inclusivity. Okay, so we welcome and honor conventional medicine, which we think of allopathic, traditional biomedicine for all its beauty and successes and wonders, while blending in approaches that are healing oriented. They tend to be based in ancient practices, so what we would call Eastern practices. So think traditional Chinese medicine, think Ayurveda, think meditation. So we are shying away from the word alternative.
Yes.
Alternative insinuates this framework of right versus wrong, like mainstream versus fringe. So we'll scratch that word alternative.
Yeah, I think also sometimes people think of alternative as not FDA approved or not evidence-based. So, okay, so we'll stick with integrative. I love the word blending. I think that not just in medicine, but in everyday life, things tend to be so binary. It has to be either or. So it's a yes and, right? And I think that's how we should be talking about many things. It might be helpful. I don't know. I'm just thinking, I'm a primary care doctor, also known as a general internist, just like you as well. But maybe we could talk about a couple of conditions, like common conditions that you and I see all the time in the exam room, and maybe talk about those approaches and maybe what I would do in my, traditional, approach, and then how maybe you would approach it kind of through that integrative lens. Because I think the framework, as opposed to a practice, is really a helpful way to think about it.
Sure.
Why don't we pick back pain, right? Yeah. So, let's say we have a patient who comes and they've had back pain for 6 weeks and it's on the left lower side. And, in medicine, we always say, are you having red flag or alarm symptoms, right? So we're like, oh my gosh, are you having fevers at night? Is it waking you up? Are you having numbness, or if you're losing control of your bladder, God forbid, right? But, and I might say, gosh, let's start with some physical therapy, do what we call NSAIDs, which is fancy for ibuprofen, in that class of medication. But tell me how you'd approach it.
Yeah. So back pain is the number 2 reason for visits to a primary care physician after number 1, which is respiratory infection. So it's something we see all the time in the primary care setting. And all of us here have experienced back pain to some degree, I'm sure, as well. So it's important to note that back pain is a symptom. It's not a diagnosis, okay? So why do we have back pain? What's the root cause is always a question to keep in mind. It might be due to biomechanics, right? Maybe it's tight hamstrings or a weak core. Perhaps it's postural, right? Think tech neck, right? Which many of us suffer from. Perhaps it's a structural problem like degenerative disc disease or spinal stenosis where there's an actual problem in the bone, right? Or it might be as simple as you need a new mattress or the pillow's too flat. For women, maybe you're wearing the wrong size bra or the bag is tugging in the wrong way on your shoulder. So I say this to illustrate that back pain is a symptom and the diagnosis is important, but what I'll outline generally works well for back pain from all of these causes. Okay. So number 1, heat. Do not underestimate the power of a heating pad. It is cheap, it is effective, and it is easy. Heat helps to bring blood flow to the muscles. It helps to soften muscles. And it can be used readily at a moment's notice. Right. Okay. Massage, whether self-massage, whether massage from another person, whether through use of one of the many home-based tools, same mechanism as with heat. It helps stimulate blood flow and helps to soften tissues. Acupuncture. So acupuncture philosophy rests in the idea of the 12 meridians. So from head to toe, there are 12 meridians that are usually named after organs. And the philosophy rests in the idea of qi. So the energetic currency of qi, which loosely can be translated into spirit. In acupuncture, when qi is stuck, then pain ensues. So the needles work to unlock the pathways so that qi can then flow smoothly. Okay. And the data supporting acupuncture for back pain is so robust that now Medicare covers acupuncture for chronic low back pain for patients in the United States.
Thank goodness.
Yeah. And finally, I'll mention yoga. Yoga is a practice, and the word means, it comes from the Sanskrit yuj, which means to yoke or to unite. So as a system, yoga blends physical postures, which we call asana, with breath work, which we call meditation, which we call pranayama, to then unite body and breath. So yoga, like acupuncture, has such robust scientific rigor that the American College of Physicians, in its guidelines for management of low back pain, has listed yoga as a first-line therapy.
I just want to say that not only have I learned Latin today, but I've also learned Sanskrit. Thank you very much. Okay, no, this is wonderful. And I think, back pain is such a common diagnosis. And again, it's not an either or. And there's obviously, a sequential approach as well. But what I'm picking up on especially is that what you said, back pain is a symptom, not a diagnosis. And so that reminds me again that you're really looking at someone as a whole person, right? And acknowledging that they're not just one muscle, right? Or one joint.
Yeah. I think back to medical school days where we used to call patients as the diagnoses, right?
Yes.
Like that's the cholecystitis,
That's
right?
right.
That's the diverticulitis, that's you're pairing the diagnosis with the patient, but no, it's the patient with the cholecystitis,
That's
the patient
exactly
with
right.
the diverticulitis.
Yeah, it's how we identify. You're a person who then also has, a symptom.
Yeah.
Okay, I love that. And, I maybe we could also then, because this back pain is, again, while it can be connected to a lot more going on, mentally and spiritually, but how about something like sleep or even stress? I'd like to think that I'm not just prescribing sleeping pills for everybody, but, lots of times when people come in with a symptom, right, of sleeplessness, sometimes they're prescribed, kind of not carelessly, but just kind of quickly, a sleeping pill. And I'm just, how are you assessing someone's sleep or helping, evaluate and improve that?
Yeah, we all deserve a good night's rest, right?
Yes.
And just like I think of our phone, the way we charge our phone every night, we should be charging our bodies every night, to full capacity. So ideally we charge continuously without interruption. So we start the day at 100% battery, right? So that's the analogy I like to give. Insomnia, which is the medical term for an inability to sleep, can be a primary diagnosis, but commonly I see it paired with something else, right? There usually is something else going on, whether it's anxiety or stress or fatigue or some of the many symptoms that go in this family. So yes, while you're looking for the root cause of the problem of insomnia, here are some tips to at least get that good night's rest, right? Magnesium. Magnesium is nature's original chill pill. Yeah. 80% of the body's functions magnesium takes place in, and believe it or not, 50% of us are deficient in magnesium. So magnesium deficiency can lead to insomnia, anxiety, muscle aches. How many of us suffer from that happy trio? So magnesium supplementation is an easy way to at least take off the edge, help with a good night's rest, which usually comes with a bit of anxiety too. Lavender oil. So research studies show that lavender oil can be just as effective as some of the prescriptive hypnotics that we use to calm the mind.
It's amazing.
Yeah. And then finally, I'll mention mindfulness. Mindfulness has really made its way into the mainstream parlance. To quote our friend and colleague Diana Winston, mindfulness is the experience of paying attention to the present moment experience without judgment, with openness, with curiosity, and a willingness to be in that space. It is a quality of attention. So mindfulness can be practiced seated and still, what we think of as meditation. It can be practiced in a number of movement-based practices. Think yoga, tai chi, qigong. One can be mindful while gardening, while knitting, while walking in nature. So it's a quality of attention that is rooted in present awareness.
It also just makes you feel like your whole day and life aren't slipping away when you're paying attention.
Yeah. How much of our days are we really worrying about the future or living in the past? But it's here and now.
You always think of attention as like gifting to other people your attention, but it's something you need to gift to yourself, right?
Yeah, absolutely.
I'd love to ask you, what's inspired you to pursue integrative medicine? Especially since, by the way, not to sound so Harry Potter, but you could have pursued the culinary or yoga arts.
Yeah. So my foray into medicine began with an early love for food. So I was a college student here at UCLA, and I fell madly in love with food. All things related. Magazines, cooking shows, restaurants, cookbooks. And this was the time when the farm to table movement was really gaining full force. I even planned my college schedule around the Santa Monica Farmers Market. So with these two loves in hand, food, medicine, I was pre-med at that time. I was torn between how do I choose? And I realized quickly that I didn't need to choose, and I could synergize these two loves really through nutrition. So nutrition was an early thread in my medical training. And through medical school, I found yoga, which continues to be a grounding force and my love language, while I came to the practice to expand my physical strength and flexibility. The beauty of the practice has been the mental softness and clarity that allowed me to get through the formative times of training. And then I found further training as an integrative medicine fellowship and acupuncture training, and now I synthesize these many interests as a primary care physician, seeing patients in an office setting.
So it sounds like the decision was actually pretty emblematic of integrative medicine. Instead of, it doesn't have to be an either or, right? It's a complete blending of your interests and your passions. Mm-hmm. I mean, I have to tell you, I feel more mentally soft and have the clarification just being in your presence. No, and I know your patients do too. I mean, you're one of the finest doctors I know, and it makes such a difference to just feel that you're caring for people through this additional lens. And I agree with you. This is how we all should be caring for our patients, irrespective of what your specialty is, right? So if you're a cardiologist, if you're a surgeon, if you're in primary care. Yeah. One of the things that you described at the beginning was a relationship with the provider, relationship with your doctor, and how that itself can be healing. Yeah. And I just wondered if you could talk a little bit about that. I don't think people mention that a lot, about how that partnership can also be so conducive to your wellness, your health, which, by the way, is very dynamic, and establishing that care and then moving together, through time with the provider.
Yeah. I tell all of my patients, I am a coach for you in this journey of health. Yeah. And we know that the healthcare landscape is confusing. It's noisy. It's very hard to navigate primary care, specialists, referrals, insurance. Like, what does that all mean, right? 15 years into this and I'm still confused. So it is a partnership. I tell my patients, I am by your side, play by play. We are making decisions together. I am your thought partner. Mm-hmm. I am your coach. So that is the relationship. It's gone are the days of the paternalistic relationship,
yes.
Of decades long ago.
Maybe we could stop for a second, because I use the word paternalistic all the time. Let's just talk. I mean, let's take a moment, if you don't mind, and describe what kind of that tradition is, and how I think especially you and I really try to espouse and adopt an approach that's not paternalistic.
Yeah. The paternalistic relationship is doctor says something and patient obeys.
Yes.
Yeah. And that was the framework of the early days. Yep. And I will admit, some patients still do well with that approach. Mm-hmm. Some patients need to be told what to do and they need to follow the rules. But in general, I find that patients crave to be more proactive in their healthcare. They want to be active participants. They want to, engage that agency, that personal and collective agency. And our role is more as a coach and a cheerleader, mm-hmm. whereas the patient is the captain of the team.
Right. I like to think, although I'd love to hear from our patients and our audience, I think that engenders more trust.
True. Yeah. With communication, trust, with respect, that is the foundation for any healthy relationship.
Right. Yeah. So you, as I mentioned at the beginning in your introduction, you're our first, medical director of our UCLA Health Integrative Medicine Collaborative. Can you tell me a little bit about that?
Yeah, so the UCLA Health Integrative Medicine Collaborative was found in 2019 mm-hmm. as a means to bring together our myriad of programs that UCLA Health has. We have over 40 programs that fall under the scope of integrative medicine, and the idea was to bring together all these programs under one shared aim, one unified vision. Mm. Some of these programs have been in existence for over 30 years. You'll recognize SIMS-MAN, Center for Integrative Oncology, mm-hmm. Yes. Center for East-West Medicine, UCLA Mindful, People-Animal Connection. So we were dancing in various circles across town under different leadership, and we came together and said we need to be one collective group, working together, lifting each other up. So we are now a group of over 90 individuals representing over 40 programs. We host an annual conference every year in the fall. And our ultimate goal is to build a building. So the UCLA Health Center for Integrative Medicine. So we have plans to build a building in Santa Monica to unite all of these programs in one central space. Think of it as one-stop shopping where patients can seek their primary care, their specialty care, yoga, acupuncture, their teaching kitchen, meditation. Yeah,
well, tell me more about the teaching kitchen. I mean, especially since I'm not going to barrage you with like tons of nutrition and supplement questions, but about like the teaching kitchen, what are some of the principles that you want to get out there regarding nutrition through this integrative lens?
Yeah. I thought I was going to go to culinary school. I signed up, I applied, I was going to be in New York for a year in the year between college and medical school. And then I quickly learned that the culinary arts is not learned from a book. Right? We can study books, we can take tests, but really the way you learn how to cook is in the kitchen, which then sparked my decision to work in restaurants for a year in LA between college and medical school. So how do we learn to cook? It's by cooking. So the hope is to have a teaching kitchen where patients, students, medical students, trainees of all types, physicians, colleagues, healthcare professionals can then learn how to shop for ingredients, how to wash vegetables, how to cut onions and to prepare meat and to season and to find joy in the process too. I think a central message of nutrition is about finding celebration in the process. It's about connection, it's about joy, it's about nourishment. So that's the narrative of food that I hope to engender.
Okay, fantastic. I can't wait. And I can't wait to cook together, FYI. So, I mean, I will say, I mean, I have some questions. This is our asking for a friend segment, or because this is medically speaking, asking for our medically speaking friends. I mean, I'm just going to ask right now, since you're talking about cooking, what is your favorite recipe? Or what do you find most nourishing, I guess?
On a warm, chilly night, I love a lentil soup.
Okay.
Especially with chickpeas, dark leafy greens, seasoned generously with garlic, lemon, herbs, olive oil. Shakshuka is a staple in my household, right? So
Very
eggs
nice.
that are poached in a tomato pepper sauce.
Yes.
Yeah. And I have to admit, I'm a West LA gal, so I love my avocado toast. Yeah. So I prepare mine with a thin slice of a dense rye bread, toasted, thick layer of avocado, olive oil, and flaky salt.
We will be posting your recipes, so with your permission, of course. One of these things, I think that, as I said, when I'm listening to you speak about these techniques and this framework, I'm like, okay, can I start my acupuncture now? Can I start meditating now? I think a lot of people, and one of our questions that we have is, I feel so overwhelmed. I want to meditate and I want to get acupuncture, and I have like maybe 30 extra minutes in this day. So what would you say to everyone? I mean, where does one start? How does one integrate just one of these practices into their day, just as a start?
Yeah. So consider the analogy of a menu. At a restaurant, you're presented with a menu, you peruse your options, you see what sounds good, you make a choice, you try it, and the next time you return, you either love that choice and try it again, or you try something new. So the same applies to the vast menu of options in the integrative medicine toolkit, right? Your choices will be different from mine. I might cling to one, you may toggle among three, and the choices will evolve day to day, even hour to hour, week to week, and in seasons in life. So I share this to illustrate that there isn't a prescriptive one-size-fits-all recipe that is right for the general public. It is a deeply personal choice, and there's beauty in that choice. And it's not that one is better or worse, we're just uniquely different. I mentioned mindfulness. Mindfulness is a tool that we can turn to at all times. It's a quality of attention. So that is a great place to start if you want to bring in an integrative modality into your days. I will also mention breath. The breath is a powerful antidote to our busy mind. It is free. It is accessible. And how often are we really paying attention to our breath? So I invite you all to just be more conscious of your breathing. A deep inhale, a long exhale. The breath is a tool to access our parasympathetic nervous system, the part of the autonomic nervous system that is responsible for calm, for relaxation.
I'm feeling calmer. I'm completely have my parasympathetic nervous system in high gear. Also, I just want to point out, you said breathing is free. I don't think I've ever said that out loud, but breathing is free. Anything else that's honestly just, free to start? I mean, you mentioned meditation, and you mentioned Diana Winston, who is one of our experts here at UCLA Health. Does she have an app or?
Yeah, so the UCLA Mindful app is free. There are guided meditations of various lengths. There are Spanish options as well. Great. So a great way to begin your mindfulness practice is to download the UCLA Mindful app. UCLA also offers yoga therapy twice a week on Zoom. It's on Tuesdays and Thursdays awesome. During lunchtime, taught by the lovely yoga therapist Julie Rowland. Yes. So those are two great ways to start, the UCLA Mindful app and UCLA Yoga Therapy.
Terrific. I have one more question for you, just from asking for a friend. There's a lot of people that have sworn by Dr. Sarno's book about curing back pain through a mind-body approach. So less about Dr. Sarno, but more about just, I think, getting back to all those different parts of us that contribute to how we're feeling or symptoms. I think we talked about back pain, we talked about insomnia. Any other, though, like chronic conditions, even things like rheumatoid arthritis, which is an autoimmune condition of the joints that you feel like, benefits from an additional integrative approach?
Yeah, so back pain, I'll share the story with you about a patient she's a middle-aged woman who has debilitating, crippling back pain. She has had an MRI of her entire spine, which is stone cold normal, whistle clean, not a flaw in sight. She suffers from high anxiety, depression, substance use, a lot of financial strain, and her back pain augments during the times of emotional lows.
Sure.
Yeah. I still haven't figured her out, but it's a humble reminder whenever I see her that there are nuances in the body that we still can't understand and mysteries that are still left unsolved. But truly, there certainly is a component of emotional impact to the physical manifestation of pain.
No, I think even the term emotional load, that's really visual. I mean, and it's very... It doesn't need to be, but it's very physical. Our lives can be really challenging.
Yeah.
And it really is. I mean, I think sometimes we use the words whole person care. And I really feel like the integrative framework approaches that. I'm going to ask you, is there one integrative health practice, I don't mean to make you choose, but that you really personally swear by?
The truth is yoga.
Yeah.
Yeah.
And you do it every day?
Every day, every morning, no fail.
Yeah.
On the mat. It allows me to access a part of my...
We were just looking, Annie, our producer, always is holding up signs for us when our words are too big.
Sorry, I was just going to...
Does that say respiratory?
Well, she said that's the number one thing.
Oh, yeah. No, absolutely. Well, we talked, that's absolutely right. So we talked about back pain being number 2, and the first is respiratory. That's when all of you people, including myself, come in with something respiratory. Also related to breathing, but like when you come in with an upper respiratory infection, which means coughing, bronchitis, inflammation of the airways. Thank you for bringing that to our attention. We don't even realize how much we play and talk inside baseball. Okay, but please, so yoga. So you do it every day.
Every morning, I think of it I approach it like the way I brush my teeth and wash my face, just something that I do. Yeah. And when you have these habits that are, infused with consciousness, then that's what I call a ritual. Yeah. And I can't imagine my life without it. It's with me forever. It's this lifelong journey.
And have you taught your kids? Or you practice with your kids, right?
Yes. Yeah. I try. Yeah. And they teach me too. So it is a mutual partnership between the two of us.
Yeah. It's really humble making. Is there any certain position with yoga?
Oh,
Is that a hard one?
So there are some that I love more and some that I love less, of course. And they're all uniquely important in the collective experience, of course.
Yes.
The poses that I have been gravitating towards recently are those that target the inner thigh. Yeah, it's a body part that doesn't get a lot of attention and a lot of love. So think, triangle pose, think any of the wide leg forward folds or seated forward folds. So that is the flavor of the moment, but that answer will change tomorrow and next week and next month.
Okay. Is there anything that I forgot to ask you about, integrative medicine that you wanted to share? Just want to make sure
Yeah. A guiding ethos that I tell my patients that I think really sums up what integrative medicine is about is this idea of I can give you a prescription or I can coach you to heal yourself.
Yeah.
Yeah. So it's the idea of patient as captain and us as coach and cheerleader, to be able to really cultivate this sense of personal agency, to engage and to activate and to empower.
I think that's exactly it. It sounds very empowering. And you're there, right, as the partner, as the coach. But I mean, that's the whole point we're even having this conversation today, right? Is you shouldn't have to go to medical school to know how your body works, to know that this amazing approach exists, that these modalities, which is another fancy word for techniques, right? These practices are here so that you can feel great, you can feel optimized. Exactly. And I think that's where, when you were talking about health or keeping healthy, I mean, sometimes we have to heal something every day, right? And we want to keep healthy. I do want to just have a couple of questions before I get to kind of your takeaways. But has there been anything, along your medical journey that's surprised you?
The power of the body's innate capacity to heal. Yeah, in medical school, there's a saying, the doctor's job is to entertain the patient while nature does the healing.
Yes.
And the body knows how to heal. So we distract it from that innate process. But as long as we provide the sun, the water, the fertilizer, our bodies know how to flourish.
I will tell you that the longer I am a primary care doctor, the more I give the advice, please go outside and feel the sun on your face. And breathe in some air. And, your body, right, which is we're all part of nature. I mean, honestly, it reminds me of right now it's springtime. We've just had these horrendous, devastating fires, and definitely the neighborhood I live in. And right now, these green shoots of grass are sprouting everywhere. So, yes, even in the midst of, these horrendous burns and destruction, right, nature heals and prevails. And our bodies do too. Yeah. They can take an enormous amount.
Yeah.
Okay.
This idea of resilience, right? The body's ability to rebound and recover when it is knocked down.
Absolutely. And it can take time. I will always want to tell my patients that. Okay. So medically speaking, I want to leave our listeners and our audience. I mean, first of all, you've shared so many amazing kernels of advice and wisdom, but what are 3 takeaways that you really want everyone to know about integrative medicine?
So 1, explore the menu. Okay. There isn't a prescriptive one-size-fits-all approach, and we all have choice. And I encourage you to explore. Cast a wide net. See what lands. The practices should leave you feeling joyful, nourished, rejuvenated, connected. And if it doesn't, move on. No strings attached. So again, your choice will be different from mine. I may toggle through 3, you may adhere to 1, and that's all beautiful. And our choices will evolve over time, just like our preferences for food, our choices at a restaurant. So explore the menu, peruse it, and explore and have fun in the process.
I mean, that's also a recipe for life, relationships, all of it.
Yeah.
It's wonderful. Any other advice for just living a long, healthy life? But instead of long, just like full of just quality, I guess I would say too.
So the obvious answer is movement, nutrition, manage stress, sleep well. Those are the 4 pillars that I continually promote. The 5th pillar, the more exciting pillar, is the quality of your social relationships. More and more research is coming out, and I cite specifically the Harvard study for adult development, which is a study of over 85 years, which concludes that the quality of your relationships is tied to health, happiness, and a long life. Yeah.
It's marvelous. Well, I have to say the quality of our relationship and getting to work alongside of you is extremely nourishing. I learned something from you absolutely every day. I've learned so much from you just even today, and I just can't thank you enough for sharing not only like what you know, but who you are, you know, with all of us, with your patients. Your patients are so lucky to have you, but also obviously your friends and your family and your colleagues. And don't even think you're not coming back, because I have like 1,000 more questions, and we'd love to have you on a million times. And but really, that's all for today. That's the end of our episode on Medically Speaking. Until next time, obviously heed Dr. Elizabeth Koh's advice and stay curious, ask questions, and stay healthy. Thank you so much.